There are three major types of panaxes of ginseng. There's Panax ginseng or Korean ginseng, Panax quinquefolium or American ginseng, and there's also Siberian ginseng. There are also some negative effects when using ginseng. Some of these side effects include vaginal bleeding, nostalgia, nervousness, insomnia, and hypertension. Although it depends on which Panax is used, there are many different benefits to using ginseng. Benefits include increased immune function, increased proliferation of neural progenitors, increased levels of acetylcholine, serotonin, norepinephrine, and dopamine. Ginseng helps with antioxidant effects, as well as anti-inflammatory effects and anti-stress effects. Lastly, ginseng also helps with analgesia, vasoregulatory effects, reduced ventricular remodeling, antiplatelet activity, increased insulin release, as well as anti-cancer properties. There are also some negative effects when using ginseng. Some of these side effects include vaginal bleeding, nostalgia, nervousness, insomnia, and hypertension. Ginseng has never been evaluated by the Food and Drug Administration. Also, ginseng is not intended to diagnose, treat, cure, or prevent any illness. There is lack of controlled research to demonstrate the ability of ginseng to improve or prolong performance in humans. Also, clinical trials have shown few, if any, benefits to help physical and mental performance. The efficacy of ginseng as an ergogenic aid has been inferred primarily through anecdotes, testimonials, and through animal research. Some randomized controlled trials show that ginseng improves quality of life, but it doesn't increase their composite scores while using Panax ginseng. There have been better results by using Panax ginseng and Panax quinquefolium to show a reduction in blood glucose levels. Standard dosing is 1 to 2 grams of Panax ginseng root, administered orally and taken for no more than 3 months in a row. Over the past few years, there has been a lot of research done to determine whether ginseng is a good ergogenic aid. A study done by Kang, Kim, Lee, and Byrne showed that hormone levels did not differ significantly after ginseng treatments. Chase, Darby, Liang, and Morgan employed a double-blind test to determine whether VO2 max changed significantly when using Siberian ginseng versus a placebo. Their test concluded that there was no significant difference in any of the factors that they were testing for. Tsu, Ho, Lin, Tsu, and Su had a similar experiment to that of Chase, Darby, Liang, and Morgan, except instead of using Siberian ginseng, they decided to use American ginseng. Their VO2 max test showed that creatine kinase levels went down when using American ginseng, however it did not enhance performance whatsoever. Angles, Kolalokuri, Cieslak, and Worth had a double-blind experiment to test whether Panax ginseng worked well with anaerobic exercise. Their results concluded that there was no significant difference when using Panax ginseng versus a placebo. One final experiment to determine whether ginseng is an ergogenic aid was done by Kim, Park, Chang, and Sung in order to determine whether Panax ginseng worked well during aerobic exercise. They administered a treadmill test before ginseng use and 8 weeks after ginseng use, and the results concluded that ginseng is an ergogenic aid because their times on the treadmill was 1.5 minutes longer 8 weeks after ginseng use. Overall, there has not been enough evidence to determine whether Korean ginseng, American ginseng, or Siberian ginseng can be used as an ergogenic aid. As of right now, there have not been enough extensive studies to determine whether ginseng can be used as a performance enhancer. Through my research and conclusions, I would say that ginseng is not an ergogenic aid. However, it can be useful in several other areas already shown in this video. For more information, there are many different library databases at GW to help with more information on ginseng. Some of these databases include Access Medicine, EBSCO Medline, Clinical Key, EBSCO Health Policy, and Lexicon. If you do decide to take ginseng as an ergogenic aid, please remember to note all side effects and benefits that can come with your use of ginseng.